On this episode, we will talk about depression and weight loss surgery. We'll talk about flying restrictions after surgery, and we'll talk about having surgery as a teenager. Hello everyone, I'm Dr. Alvarez with Endobariatric.com, and welcome to episode 212 of the AskDrA show. Thanks so much for joining us, and if you're new to the show, well, let me explain how this works. You can ask me questions regarding weight loss surgery in general, gastric sleeve surgery, and there is a way to do so. That is using the hashtag AskDrA throughout social media. That way we're able to grab those questions, add them here to the show, and that is what the show is about, me answering those questions. And if you are into these subjects, weight loss surgery, gastric sleeve, I would suggest you subscribe to our channel because we upload a lot of content. Let's get into the show. All right, so our first question is, what specifically was made, can you get weight loss surgery if you suffer or you have depression? The answer is yes, but you need to line up the ducks. What I mean by this is if you have a official diagnosis of depression, if you take one medication, two medications, somebody sees you for this condition, there is a way to have weight loss surgery, yes, and that is by having clearance by your doctor saying that he or she knows you. You are under this treatment, you understand what you're getting into and the possible outcomes. And if that is something you can do, get a letter from your doctor, line up those ducks and square things off, yes, you can get weight loss surgery. This will vary from practice to practice, country to country. Europe is different, the US is different, us in Mexico is different. But yes, you can, because being obese is one of the major causes of having depression. And we know that if we help you and correct this problem, vast majority of the patients drop medication that is used for depression. You get better with that depression, you get out of that depression, and life becomes way better. All right, so the second question is flying restrictions, and this question in particular comes from a patient that works in an airline, and I decided to twist a bit this question to make it more of general use and answer the question is there any flight restrictions after surgery? The answer is no, because nowadays, airlines have the technology that pressurize the cabin, so there's no change of pressure as the airplane rises and comes down. So that will not affect the sleeve, it will not affect the patient, although just in general, by itself, flying, because you're in a certain position for so many hours, if it's a long flight, is known for causing deep vein thrombosis, etc. Just the flying itself. All right, it's not related because you had surgery, so it is by itself. So we recommend patients who fly use compression stockings. I use them every time I fly. I do exercises that prevent, pump those calves, prevent the stasis, the blood just staying in a certain area in your legs. I make myself walk the aisle as I go to the restroom, just walk, get yourself up and going every hour or so of flight. And if you do that, that will diminish the risk of deep vein thrombosis. Again, that is because of flying. But is there a risk or is there a restriction per se of having weight loss surgery if you take these precautions? The answer is no. Our patients fly, vast majority of patients fly 2 days after surgery. We've never had an issue, and we've been doing this for close to 18 years. So the answer is no. To answer this particular question, this patient who works at an airline she can get back to working whenever she's ready, 5-7 days after surgery. And our last question is, can a teenager get weight loss surgery? The answer is yes. We actually do teenagers pretty much every other week. Minors, we do require that the patient has the consent of both parents, even though if they're divorced. We want both signatures on the consent to make sure the teenager can get surgery. Depending on the case, on teenagers, we do require a psych evaluation just to make sure the teenager is capable of understanding instructions, directions, and following them as well. So this is a case to case. This will vary. We can go down to 12, 13 years old, depending on the situation of each patient. Sometimes we require pediatricians' letters and clearance, endocrinologist, nutritionist, so on and so forth. And this again will vary from patient to patient. But the vast majority of 16 and older, nothing much is required other than the patient's consent forms and sometimes a psych evaluation. Again, will vary from patient to patient and practice to practice. But the answer is yes, we do teenagers. Teenagers are, since obesity is on the rise, and for the last decade or so, yeah, more or less, we've seen a rise in teenage obesity, and patients are getting surgery more and more. All right, so there you have it. I hope you found this useful. It was a very interesting episode, and if you did, leave me one of these. I greatly appreciate it because it's very useful and supports our channel. And don't forget to subscribe. Don't forget to send me your questions as well using the hashtag AskDrA throughout social media. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.